You were saying that you hadn't had a hemoglobin A1C test for years prior to your diabetes diagnosis, and I was wondering if you could address how frequently should we, as people going to the doctors frequently, be asking for these types of tests to ensure our prevention?
I would guess that once you're diagnosed, every 3 months is appropriate. But before you're diagnosed, I would think a baseline once a year for, maybe even every 5 years is not, unreasonable. It's not the cheapest test in the world, but it's certainly not the most expensive. So the idea of a baseline and then periodically, depending on the blood sugars, I don't believe that my A1Cs had gotten to an abnormal point because my blood sugars were fine. And I was getting lab work at least once or twice a year with my normal, regular, checkups for my blood pressure. And I've been taking blood pressure medications for probably 25 years before I started having to take the diabetic medications. So that's what I would guess would be a reasonable reasonable baseline, just to have an idea of whether or not there's a problem.